Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. In the last block, we were talking about steroids, and now our good friend Dr. Jitka Lom from ExpressCare is here, and we are talking about anti-inflammatories. Doctor, I'm sure you've seen a lot of gout patients. You know, you've been coming here many, many years. You've been telling us how prevalent Guam is on our society, but anti-inflammatories can be prescribed directly to treat gout, am I correct?
That's true. So in gout, you have little tiny crystals that are irritating your joint, sort of like sand in your shoe, causing swelling and redness and a lot of pain. And so typically people will take Motrin or Aleve, or if they go to the doctor, the classic one is indomethacin, Indocin. These are all anti-inflammatory medicines that are not steroids. And you can take them and they will help settle down your gout, cause less redness and swelling, because at the same time you're hopefully drinking lots of water and staying away from the foods that caused it in the first place. That's the beer and the meat, pork chops, all that. So as you're staying away from those foods, the uric acid in your body goes down, and this medicines are helping the swelling. If there's a severe gout attack, we do sometimes use steroids. We will give them prednisone to knock it out much more quickly. It works extremely well. But problem is, a lot of the time, these patients that have gout also have diabetes, they also have high blood pressure, and when you take steroids, it aggravates both of those other conditions.
As you've said. Yeah.
So we want to try to work on the diet.
Yeah, so the steroids will actually like more quickly break apart that uric acid that's crystallized. Like a lot of times you'll see like people have it in their ankles and in the extremities. Incredibly painful condition.
Very, very painful. And the thing is that once there's swelling, there's poor circulation, right? So the crystals will accumulate more easily. So once you reduce the swelling, there's better circulation again. The uric acid is moving along and out of the way. And that's why reducing swelling in any condition is super important. So the easiest way to reduce swelling, if you have an injury, is use ice, okay, or elevate. That's how you get the swelling down. If you get the swelling down, there's going to be less pain and better circulation.
We're not talking about ESP, but I truly believe you've read my mind, because I was going to say, you know, for home remedies, what do we do? Like if I'm out running or I'm playing volleyball and, you know, I happen to like twist my ankle and I get like, you know, like a little minor sprain, should I actually, you know, go towards an anti-inflammatory medicine, or should I just put ice on it? Should I put, you know, icy hot or some product like that? How do I know when to go for medicine?
Well, based on your own body, your knowledge of your own body, but it's not always an either or. You can, of course, use ice and take a Motrin and elevate and wrap it. Everything, all these different angles, different ways to reduce swelling are excellent. But if you're one that doesn't like to take medicine or you have other health problems, just ice it, elevate it, wrap it, and don't re-injure it.
Are anti-inflammatory medications typically available over the counter?
Yeah, they are. So you can buy Aleve, Motrin, ibuprofen. All of these things are over the counter. And since they're in small doses, people think, oh, it's nothing. But when you add it up and you're taking so much of it, for example, for headache, that's another common one. People are taking Motrin all day long, and they're taking so much that they actually develop, again, a dependence on Motrin. And then when they stop, they get a rebound headache.
Now, see, I would venture to guess that most people don't think of Aleve, Motrin as anti-inflammatories. They tend to side with the acetaminophen side of it,
right?
And think it's only a pain reliever.
Right. So that's very important. So what is the difference between acetaminophen and these drugs?
Yes.
Acetaminophen, that's Tylenol, is reduces fever and it helps you with pain. So pain and fever. The anti-inflammatories, the Aleve, the Motrin, all that, they help you with your fever, they help you with your pain, and they reduce swelling. So sometimes patients will say, oh, I don't want to take anything for pain, but I'll say, please take it for your swelling, because that will help your healing process.
Well, what you guys do at ExpressCare is you also advise a lot on women's health.
Yes.
And have female patients ever come in and say, you know, like I feel like I have to take like anti-inflammatories either because they have like, you know, water retention or maybe cramps or, you know, like various side effects from pregnancy and everything. Is that common?
Yes, but for pregnancy, we don't ever want to take those anti-inflammatory medicines, just acetaminophen or Tylenol. And I love your question, because many women out there suffer from menstrual cramps and they don't know that there's something they can do to help themselves. So for those ladies out there, the minute you are beginning to get your period, it's starting to cramp up a little bit, take Aleve or ibuprofen or Motrin if you're not allergic, because that will reduce the amount of inflammation that you have going on and cut down on not just the amount of pain you have, but also the amount of bleeding. So it's an easy way for you to cut down on your amount of bleeding.
In a sentence, can you maybe summarize for our viewers, what would be the most important thing one would need to know about anti-inflammatory drugs?
Well, I think anti-inflammatories, like anything, are a great tool when they're used appropriately in small doses. And if you're overusing them, you can do yourself great harm, especially if you're giving them to children. So take care.
All right. Well, you take care too, and we appreciate you being here.
Thank you.
All right, we'll see you next week.
Have a nice day.
All right, stay tuned, everybody. We are back. More show after this.